The knee joint is made up of three compartments. There's the anterior or patellofemoral compartment, and there are medial and lateral tibiofemoral compartments. If somebody only has arthritis in one compartment, then it may be possible to perform partial knee replacement, i.e. leaving the two compartments which are well preserved and replacing the surfaces just on one part of the knee, usually the inner side of the knee. The advantages of this are it's a smaller procedure to go through, less bone and cartilage is removed, the incision is smaller, and ligaments are preserved in the middle of the knee where they have to be removed for total knee replacement. With total knee replacement, we remove all the surfaces of the knee and replace them with a metal cap on the femur, a metal tray on top of the tibia, and a spacer between the two. So I think this is worth discussing with your surgeon. And if your surgeon feels it is appropriate to consider partial knee replacement, there are distinct advantages to having this procedure. So personally, I discuss lots of factors, particularly the pattern of arthritis. So if someone has arthritis that is widespread throughout the knee, then a total knee replacement probably is the best option. If arthritis is limited to one compartment, then a partial knee replacement is beneficial. But we often discuss the kind of lifestyle that patients have, the kind of activities people want to get back to. It may be the case that partial knee replacement gives better outcomes for people who want to mobilize more quickly and return to a higher level of function. And that may be the best option. We often have discussions with patients about their own preferences as well. People may know people or have experience of surgery with the knee that they're particularly interested in. And so we always take into account patients' own preferences in these instances. So the overall procedure is broadly similar. The operations are performed in an operating theatre, and most of the operations are performed with the patient under spinal anaesthesia, which means an injection in the back and you're numb from the waist down, so you can't feel anything happening. The incision for a partial knee replacement is slightly smaller than a total knee replacement, and the exposure is less because we only need to get to one part of the knee. When we perform the total knee replacement, we usually have to access the patellofemoral joint as well, and by moving the kneecap joint, sometimes it takes a little bit longer for the quadriceps muscle to recover and to regain full strength again afterwards. What we tend to find is with the partial knee replacement being slightly less invasive, patients tend to recover more quickly and they mobilize and return to activities slightly sooner than they would do with a total knee replacement. So the overall survival rate for both total and partial knee replacements is very similar, and it is around 95% survival at 10 years. We find that more active people tend to recover more quickly, particularly with a partial knee replacement, and may return to their activities slightly sooner. But we find overall satisfaction rates are very similar with both partial and total knee replacement. The advantage of partial knee replacement is in the future, if it has to be revised, it may be a more straightforward procedure than revising a total knee replacement. So both of these operations are invasive operations. They're performed through an incision, and there is a level of discomfort after the surgery. We take lots of measures to reduce this with pain relief, and we use ice and physiotherapy regimes that limit the discomfort. But what we find is that people recover quite quickly, and even within a few days, with both procedures, people are normally walking with crutches, bending the knee, and are able to climb a flight of stairs. We find that people recover and mobilize a little bit more quickly with a partial knee replacement, and tend to regain range of movement a little bit earlier than they do with a total knee replacement.